Good morning. Steve Stites here, Chief Medical Officer of the University of Kansas Health System. We're back with you this morning to talk about all things corona and sometimes a little broader than that. I'm joined to my right by Hawkeye. He's back with us here on the program, Medical Director of Infection Disease and Control, and Dana Hawkinson. And on the left, I have David Smith. David is one of our excellent and outstanding sports medicine physicians here at KU. He was on the show last week. We welcome him back to help us talk about youth sports. And today we also have a very special guest. I'm not going to say this right, but KSHSAA Executive Director Bill Faflick. And David, it's the Kansas State High School Athletic Association.
You got it, Steve.
Not
Good
bad.
job.
Not bad for just a kind of an amateur like me. And we also welcome Christine back to the program, our interpreter. Thanks for being here this morning. And Dana, how are things looking today?
Yeah, today things are still pretty good here at the hospital. We would like to say no cases, but we reached a peak, probably
early April.
Early April, and then recently a couple weeks ago.
24 again,
and then now we are back down to 17. We've had 17 in the hospital today and yesterday. We should note that this includes an admission and a discharge, so it's not just the same, and we continue to have those admissions and discharges daily. And so our numbers will fluctuate a little bit. Certainly the lower the better, but we go one day at a time.
It's still not quite the same. This doesn't feel the same as it once did. I mean, people have a little shorter length of stay. We've had 20 deaths, I believe, but it feels a little different, Dana.
Yeah, absolutely. And I think that...
Are we just getting used to it?
I think there's a combination of things. We are probably getting used to it, but I think those initial early stay-at-home orders, restrictions, I think really helped a lot. I think people have been more aware of this in the news and hopefully taking precautions. So I think there's a combination of factors to help with that. And again, if we can keep those most vulnerable populations healthy, those populations in the confined workspaces, the congregate living, the nursing facilities, I think that will go a long way towards keeping the numbers down as far as we can.
We know that when we get into a nursing home, that's usually a difficult population, as you say, congregate living and meatpacking plants, et cetera. Still a lot of outbreaks in Kansas. I think they're still following about 100, like 200. I think it's either 130 or something. It's a large number of outbreaks still out there. Talk a little bit about recent stuff around mask wearing. Still important, not so important? What do you think?
Yeah, absolutely. There's still there's a lot of debate. As in medicine, we have debates all the time. What is the best practice? Certainly, there are concerns about, well, you don't have to wear a mask, and World Health Organization says you shouldn't have to wear a mask unless you're caring for a COVID patient. We have to understand that the World Health Organization has to cater to the entire globe. So people in all countries who have very differing resources. We should note that their focus is on medical mask wearing. Also, they state that there's really not enough evidence for or against wearing cloth face masks. But this is in the face of them also concerned that if you wear a mask, as we have talked about many times, it's going to cause a false sense of security. You need to continue to do the same things that we've been talking about, the physical distancing. There's been concern about that distance as well. But also the hand hygiene is extremely important. So, and as we get further into these permutations and these caveats of all these statements, we also have to understand there are population studies that do show that you can have a reduction in your death rate and your infection rate if there are masking protocols in place, as opposed to countries that don't have those things. But again, we don't want to take the mask as not an end-all, be-all. It's not a preventative. 100%. These are all things to help reduce the risk, and what we are trying to get out is the message of decreasing your risk and mitigating your risk of infection to you and your loved ones.
Dave, this has been a challenging time for youth sports as well, and as a former YMCA rec basketball and football and soccer coach, I know that I loved having my kids out there. Our dance class, my oldest was a dancer. Talk to us a little bit about what's going on now with youth sports. We know that things are opening back up. We know there's a 3-2 baseball tournament here in Kansas City last weekend. Where are we?
Yeah, well, yesterday the Kansas State High School Athletics Association allowed schools throughout the state of Kansas to initiate practices, and different schools and districts have decided on different opening dates. So we did have a high school yesterday that one of our athletic trainers participates in, and she was out at 6 o'clock in the morning for a practice session, but with guidelines. And we had those guidelines established last week. Guidelines that we work closely with our partner schools and districts. We ask them to have guidelines, then we look at them and make sure they're medically sound. And I did not hear any problems out there yesterday. I hope that's the case. Yes, I heard about the 3-2 tournament on the weekend, and I saw the guidelines that they were going to implement, and they all looked very good. Whether they actually were followed or not, I was not there. But it is exciting to see them starting, but it's a bit concerning that we, as we start, may not be able to keep going if we have an incident occur.
Bill, this had to be a challenging time, too, for you and for KSHSAA, as you were, I suspect, getting a lot of opinions and a lot of thoughts about to go, not to go. Talk to us a little bit about your process and how things ended up.
Well, certainly thank you for the opportunity to visit with you this morning. And it has been the most unusual of spring seasons for us. Actually, the end of our winter season was impacted as we were trying to conclude our state basketball tournaments in March. And things changed with the governor declaring a state of emergency and then ultimately closing schools for the remainder of the school year. And as a state association that is an association of member schools, we knew that our activities for the spring would not continue per normal, but then the process begins of getting ready for the next opportunity for kids to be involved in interscholastic activities. And while we have 23 sports, we also have another dozen activities: marching band, debate, forensics, and so forth. And all of our kids are anxious for that opportunity to re-engage with their peers, to re-engage in an activity they love, to be part of a school program, a school team, to work with their school coach or sponsor. And we wanted that to happen as soon as it was appropriate to do so. And it's unusual because, we're very prone to having rules and regulations that allow a common start. This has required the highest level of agility and the most flexibility that I think this association has demonstrated in a number of years, as we know that not every part of the state of Kansas is ready, yet we needed to have a unity piece that would allow for a unique application at the respective geographic areas. And certainly we've begun to see that. We put a plan in place.
Well, I have to say it. Go ahead.
We have a plan in. Our protocol includes using our Sports Medicine Advisory Committee, which Dr. Smith is a part of, to help vet all of the guidelines that we have in place to begin that gradual reacclimatization or reacclimation to activities after a period of no activity.
I'm glad to hear you talk about speech and debate and forensics being part of the KSHSAA. For those of us who are better at running their mouths in high school than running their legs, that was always an important choice, and I made it frequently, as it turns out. So what are some of the concerns you're hearing people raise? I know we've talked a lot on this program about whether or not it was safe, and we really emphasized whether or not the home is safe with folks who may have chronic disease or older, because we know that people like that have a worse outcome with COVID. What were some of the considerations you all give to home environments and things where kids have to return to?
Well, certainly our students are coming from home, and first and foremost, we're educators. We're all teachers and coaches, and we want to make sure that we understand ourselves, best practice, and that we are able to share that with our school leaders and our school administrators, our coaches that work directly with those students, so those best practices can be developed. And really, there's a clamoring for doing the right thing and for understanding what is the right way to address this, and to allow local health departments to have the appropriate role and underneath the guidelines or the platform that the association is able to provide for our member schools.
So, Dave, if somebody has a family member at home who is more chronically ill and has underlying disease, cancer, heart failure, whatever, Is there specific guidance we give to young athletes, or do we even say maybe you shouldn't be a part of it? Will coaches be reasonable and thoughtful about that?
You know, we don't know that many times because they may not want to share that information. Our athletic trainers and the coaches do get to know these student athletes fairly well, and I would bet that they know what's going on in the home situation in many cases. And in that case, it would be one that I would encourage our athletic trainers and coaches to say, hey, pull them aside in a confidential manner and say, how are you doing, number one? Just check on their mental health. Because having someone at home with chronic disease is a stress in and of itself.
Yeah, you bet.
And then to discuss some of the precautions. We've talked about all the things that can be done. In fact, I coined an acronym, and we talked about pillars of caution last week. And I came up with the 6 tips. I have 6 things that I think about. The 6 tips. S is we have to social and physical distance. The 6 feet is very important in practices. The I in that is to increase in frequent use hand washing and gelling and cleaning equipment in our environment. All very important. The XT is keep your hands away from your face. Don't touch. XT, don't touch. And then on the I, it's that we need to be really illness awareness, and assess ourselves, watch for fever, chills, coughs, things like that. We're going to have guidelines that we want them checking their temperatures before they come to practice, and we actually have a flow sheet. We're going to keep track of all that. And then the P is please cough in your elbow and sneeze in your elbow, and if you blow your nose, keep your hands away from your face. And then the S, of course, is stay home. If you're ill, stay home. Report that to someone. Don't be afraid to say something for fear that a coach might not let you into the practice or you can't make the team because you missed a couple practices. So the 6 tips are important, but that chronic disease is so important. And we hope that we have the opportunity to have a free discussion of that with each athlete. And I guarantee, and Bill, you can really speak to this, our coaches are on board. The Sports Medicine Advisory Committee is across the state of Kansas, all kinds of professionals, from physicians to athletic trainers to athletic directors to our executives. And we pay attention to that. And thankfully, Bill, kudos to KSHSAA, because the Sports Medicine Advisory is not just someone over on the corner. KSHSAA really listens to what we have to say, and we work together.
Absolutely. Our Sports Medicine Advisory Committee is one of our pillars of maintaining student safety with our activity program, and we're no better than the risk mitigation processes that we put in place. So we truly appreciate the insight, the perspective from across the state that come together to make some tough decisions and recommendations that we take very seriously as we implement them.
Dana, we know we're going to focus on sports medicine, but there was a couple of big news items yesterday that came out of the infectious disease world. I think that there were some preliminary results of remdesivir, which again looked good. Anything you want to say about that this morning?
Yeah, again, I think we have to be still wary that this is not a panacea. Remdesivir is not a panacea, and the experimenters, the people running the trials, have said that from day one. But what it looks like is it's certainly, given at the right time, can certainly help recovery of patients who do get COVID-19 infection.
It appeared that moderately ill patients would recover faster, leading to less oxygen, less ICU time. So I think that's encouraging news and begins to make you think, okay, we're headed the right direction. And then I believe Eli Lilly was coming out, announced yesterday that they were in phase 1-2 trials looking at an antibody based upon the antibody that your body makes, and for treatment as well. And I think that could be encouraging news.
Yep, and I think as we get further into this type of molecular biology where we talk about antibodies as treatments, where we have used them in the past, but specific antibodies right for the virus or for the spike protein is very important, along with the vaccinations. We know about the vaccination news that has come out. A lot of these are based on molecular biology techniques now, as compared to vaccines from the past, which are different techniques. So I think as we get further and further into this, we are certainly using technology to help us move us along at a more rapid pace than in the past. Again, as long as we're doing it safe. And we should also note that when we are using just the antibodies or just these pieces of the virus, if there is a vaccine or a treatment, that will not give you the infection. A lot of people say, I don't want this vaccine, especially flu. I don't want to get influenza disease from the vaccine. That will not happen with these vaccines if they are able to come to market, and even if we're able to use this antibody, this specific antibody for treatment.
Yeah, some encouraging news and moving so quickly around this in COVID-19, and we're delighted to see that. Well, let's turn first to the media and see if there are questions that any of you have this morning for our panelists. I'm not hearing any, so I'm going to turn to Jill and say I bet there are some public questions because we know that youth sports has been a hot topic every day.
We do. We have several. What are the best practices for parents who have children participating in club and rec sports since restrictions are no longer mandated in Kansas?
All right.
We're going to get the same kind of question over.
Best practices. And I think that we have to keep, I'm going to bring this back to this context of home. There's a question about what's safe for a kid. Kids are pretty easy here, right? Because they don't get that sick, by and large. They do get some things. We'll talk a little bit about that tomorrow. Just to say, we have a topic for tomorrow, all things kids and COVID. We'll be joined tomorrow by Rob Lane, the Executive Vice President, Physician-in-Chief at Children's Mercy, and Angela Myers, an infectious disease physician at Children's Mercy, as well as Steve Lauer, one of our outstanding general pediatricians here at KU, to address some of the issues around kids. But in general, kids don't get as sick. But the younger you are, the more wrecked you are. You just have to weigh that against, I'm going to come back to again a lot of the theme of this program. How safe is the home environment as far as the health of people? Yeah. So Dave, take first crack.
Well, we've got Bill on the line here, and KSHSAA and the sanctioned sports and activities in the state of Kansas are fairly well, a lot of oversight with them, but the clubs and the rec sports, maybe not. Now, the 3-2 baseball that occurred on the weekend, I read a lot of the things that they had implemented, and it sounded outstanding. So kudos to them if indeed they were able to follow those. But we don't know about all the clubs and rec sports. The Kansas Recreation and Parks has their guidelines, and it's actually quite comprehensive. And you can look up different sports and see the guidelines there. But they're guidelines. Guidelines are fine, but what happens out there is really the most important thing. So, yes, children may be safer. They may not get as sick. Obviously, there are some very bad cases, but then they take this home. And, in the home environment, it's so across the board. There's structure in some homes. There's a lot of unstructure in other homes. There's clean homes and homes that maybe not so clean. So, the answer to that question is hard. I'm not convinced that saying your child should not do anything for hope that then they don't bring something home. They could be playing next door unbeknownst to their parents and come home with something that way. They could go through the grocery store. I watch that when I go to a store. It's hard not to watch how many kids don't have masks on and how many parents don't have masks on. And yesterday I actually happened to see a mom and a young little, probably 3-year-old toddler walking into our clinic building. And I was walking in. I put my mask on as soon as I entered the door. But I heard the child tell his mom, "He didn't have a mask on, Mommy." And I thought to myself, I'm being watched. But the point is, we have to be so careful. And back to the mask, and on the field, maybe we have a student athlete that has someone at home. Maybe that is someone that we keep a little bit more careful with. Yeah. Maybe we put a mask, but Dr. Hawkinson said it well last week. Masks out on the field when they're sweating, breathing a lot, they get moist.
Probably lose their effectiveness.
They lose their effectiveness.
They start to sag and they get soiled, they tear a little bit. I don't know about that one. But
exactly.
Well, Bill, thoughts about it from your standpoint as far as youth and recreational sports? We've lost the feed there.
Having best practices in place is critical, and that starts with maintaining social distancing, cleaning equipment, making sure you're not sharing equipment, parents understanding that good hygiene for their kids is essential, that they wash their hands going to and coming from any activity, that they spread out during workouts. They may not travel as far. Summer is a time where we don't regulate those club activities, but it might not be necessary to travel across the country this summer, and stay closer to home and go to places where that they have good practices in place.
Dana,
it's also important to have a good plan if a student is exposed. And you talk about isolating a student. That communication is critical, and one of the big concerns that we maintain is that integrity of communication and having that honest screening from a student athlete that's going to self-report. Do they have a sore throat? Do they have any aches and pains? And be truthful with that and share that with the coach and have that coach respond in the appropriate manner and have that plan in place and execute that plan when it's appropriate to do so.
And thoughts from your standpoint about this?
Yeah, I think that we go back to our pillars that we have talked about. So if you can be outside, that's probably better. Most sports, you will probably be able to physically distance. Obviously, football in the trenches is a little bit different, but certainly baseball, soccer, it's a little bit more spread out. You probably are not going to be wearing a mask while being active on the field. But let's talk about the spectators. If the spectators can maintain the distance from each other, I think that's going to be important as well. I mean, we want to talk about and endorse healthy lifestyles, and certainly activity and sport is one of those things. So I think as we move further into this, we'll have a lot more information. We'll be continuing to talk about trying to, again, mitigate the risk as much as possible, decrease the risk as much as possible to the athletes and their parents and other loved ones.
Yeah, very important. I do believe we have a question from media now. Bill Brandmeier, who's part of 61 Sports, has a question for us. Bill?
810.
I'm sorry, oh my God, 810 Sports. Uh-oh. You can tell I'm a sports goof.
Hey, we're only the official broadcast partners of the Kansas Jayhawks and happy to be here. I also run a foundation called Shareways. We hope to advance opportunities for kids to play sports. We're looking for the return to sports, but we want it to be done safely. I'm concerned about what we define as space. What is a space that gatherings can happen? How many kids can we have in a space? How big is that space? If we have an indoor facility that would like to do a sports camp, how would you safely move kids through different spaces? I talked to Johnson County Parks and Rec. They defined a space as the size of a basketball court. And I'm just wondering what your guys' thoughts on being able to bring kids together in a sports camp type environment and what it might mean to safely distance in those environments, and what should parents look for from the organizers of those sports camps to be doing to make sure that our kids are safe when they come back and try to increase their skills and make technical development and skill development part of their summer.
That's a great question, and space is a funny deal because it has a lot of permutations, Dan, and we'll start with you just from the standpoint that first question, inside, outside, because outside makes all the difference.
Right.
And then inside, just kind of even what the airflow is like. So, Dana?
Yeah, I think inside on a basketball court is certainly very difficult, especially if you're having a number of children or a number of people in there participating. The physical distancing, the WHO minimum distance of 1 meter or 3 feet may or may not be made. Certainly, probably the 6 feet is probably going to be more difficult as well. And so now we're starting to get into the trees of all this and the weeds and really getting into the details. I think it's going to be difficult because they will be exercising, they will be breathing, coughing hard. There will probably be parents present. That's the other thing is, are we going to have other spectators or parents in there to be watching? So I think really being inside is probably going to be the biggest risk factor at that point.
Yeah, and I think the other problem is that kids are going to come in contact with each other. And so, we spoke last week, Dave, about whether or not if somebody has a sick person at home, because to me that's the big fear. I'm the adult doc here for pulmonary lung disease, and it's like, gosh, if you bring COVID home, what price have you paid if that person doesn't do well at home for one summer? Because by next summer I really am pretty darn sure vaccination will be available, the therapies will be better. So do we really lose a lot if we're not out there for one summer, or is it better to keep folks safe knowing the kids want to participate? The flip side is if they are going to participate, what's the best environment? And I would just say, man, the more outside you can be, the better.
Yeah, absolutely. And those are all great comments. And Bill, excellent question. When I envision some of the things I watch my 4 children do when they're growing up, I think of those hot, sweaty gyms with no airflow, with packed in the bleachers, and I'm thinking that is a place that I wouldn't want to be right now.
No, I think that's a hot spot.
And then also it's hard. Parents are going to have that discussion with their child. If they've got chronic disease at home in their area, their bubble, then it would be one that I would have a heartfelt discussion
I'd struggle in that.
and say, look, there's other things that we can do this summer. I did see a comment made by an organized sports organization that said, well, we're very fearful that if people don't play this sport this summer, then suddenly the popularity will diminish, and over the next few years we'll be having trouble getting people to come back to my sport.
I
really don't believe that is, first of all, that's an
an
invalid reason to not be careful.
Yeah.
And number two, this is helping children, youth, make wise choices. Isn't that what we do, Bill, as an educator? You talk about coaches and teachers. We're trying to educate. No youth have ever been through this before, and none of us in this panel have been through this before as a youth. So I guarantee, I made the comment last week that with my children, I might be thinking, hey, it's time to learn canoeing and kayaking and camping and hiking and things in our family, and maybe small groups of peers that you can do those things. They might find a lot more enjoyment with that than an organized, let's go to a sweaty gym and you got to play this sport.
You know, I do think there's a huge difference about it being outside. We keep coming back to that. It's that focus concentrated of having a lot of people inside that's just more difficult. Surfaces get touched constantly. The airflow is not the same. Kids are going to be close together anyway, no matter what they do, but it's really the overall environment I think you have to look at as far as what are the risks are. The other thing, just to say, and Dana, comment on this, but I think it's pretty clear that the more dense your exposure, the more likely you are to become more ill with it, and the more likely you are to transmit it. And so I think that density of exposure and how much exposure you have it plays a real impact on how this acts.
Yeah, absolutely. And that goes to what we've talked about in the past, because we've seen those studies, well, it can blow 12 feet or 16 feet if you're breathing. But we've always said, well, if you're outside, what is the concentration of those viral particles if they are breathing out further than 6 feet? It's probably lower. If you're outside, it's absolutely going to be lower. So certainly density of infectious particles is very important, and you're probably going to have a continued density of infectious particles indoors in the small places as opposed to outside with all the air currents and things of that nature.
Yeah, and I think outside just makes all the difference. And I want to turn to Bill for just a minute. Bill, thoughts about this discussion, and how does that translate, do you think, down to youth sports? And I know it's different, of course, on the high school level. Kids are a little older then, and I think there may be a little more formative reasons to believe they can behave and follow rules of infection control and be safer when they go home. But kids, I don't know. I think that's tough.
It certainly is, and we are teaching, we are modeling for our students, and there is a civic responsibility that we have to take care of, not just ourselves, but that greater good, that community. And through this spring, that's one of the lessons that we know has been a painful one to learn for our student athletes, is that they have a responsibility at home. They have a responsibility themselves at home and in their community to do the right thing. And we have seen this outdoor phenomenon, not a phenomenon, but that guidance come to play in our world, where many of our summer conditioning programs, they've moved weight rooms outside, they've revamped workouts for summer to stay outside and to use the track and to use the fabulous facilities that many of our schools have. We have schools going in stages and trying to reduce that density of students that are participating at a given time. And that's also important for our youth programs as well. Not having the giant tournaments, still having the opportunity to compete, but not on a large scale. It's just one summer. The fall will come, the winter will come, there will be more opportunities, and we'll still have the opportunity to participate, but we all have a responsibility now to make that sooner rather than later.
The real key here is that it's about risk. How do we weigh one risk against the other? The risk of a child who may not have as much fun in the summer not being in youth sports against the risk of disease back in the home. And I think those are hard questions to answer. That's a family personal answer. I don't know that it's a hospital or a business or a social answer. I think that's a family personal answer. We can only outline the question for you and tell you that it's real. Ultimately, the answer is decided at home. So thanks a lot for Day 10 Sports being part of our program this morning. And yes, I do know Rock Chalk Jayhawk.
Yeah. All right. So if we don't see an increase in cases in the next few days due to all the public mass gatherings on a national level, will that alter the approach to activities this summer or lessen the concern of spreading?
Boy, that is a great question, Dana. And we've been watching that a lot. Yeah. There are the demonstrations. There are more gatherings. Yep. I told the story yesterday about of riding my bike around Brookside and this Sunday, and I was back behind some of the restaurants, and the bars were packed again. And it's like, gosh, things are going on. Yeah. Are we going to see an increase? And if we don't, what does that mean?
So I think we would all like to see no increase.
Yeah, I actually like to see a decrease.
Yeah,
Let's
we would
be
like
clear.
to see a decrease. I think the ultimate answer is probably no. I think we need to continue to maintain the public health guidance and the personal responsibility and adherence to the guidance that we are talking about, maintaining social distancing, adequate hand hygiene, not touching your face, obviously trying to wear masks when you're in confined spaces. I don't think it should change anything because we all know coronavirus is still here, and that is the largest threat at this point in time. So we need to continue to educate. Other people can educate and do the best practices, again, to try and continue to mitigate and reduce the spread of this disease as much as possible.
And let's remember something. We're still in the early 19th century in terms of our treatment approach to coronavirus right now. There are just so many things we don't know about it. So when we think, gosh, we're not seeing as many new cases. Remember, we're in Kansas City. Population's less dense. It may be that there's so much more of an exposure in a really dense city like New York City. And so other areas have not stopped sheltering in place, in part because they rely on public transportation and because they do have much greater density and people are closer together. So I think that there's a lot we don't know about this disease, and many will spend their careers, the rest of their lives, writing and talking about what we've learned from this pandemic. Right now, our advice is based upon how to keep yourself safe. We know that this works. What we don't know is how much you can let your guard down and at what price you'll pay as you do that. That's really the question. And the answer is we really don't know. But what we do know is that infection control works. And it worked in Kansas City because we clearly bent the curve. Second major point. As we stay out of nursing homes with this disease or chronic care facilities or prisons, then we will have less impact of a surge because people won't be as sick because it's back in a healthier population in the general public. And so we know that those nursing homes or healthcare facilities like our own are taking extraordinary steps to keep patients safe. We have totally redone our workday. And so people are safe when they come in here. And nursing homes aren't allowing visitors. And they're taking a much different approach to infection control than they once did. So even people in nursing homes are safer than they were before. So if we continue to follow the pillars of infection control, combined with lower density, and combined hopefully with really closing off places like nursing homes from getting this disease again or in a new outbreak, then I think we'll help control the disease.
Yeah, I think we all have to understand this is a very quickly evolving situation that we are in. We have to continue to take the best practices from other countries. I don't think we can apply just one country's practices to ours just because of our size and our population. Certainly that's different than South Korea or Japan or Sweden or anything like that, but try and take the best practices from those countries, maybe apply them on the more local level, the regional or city level, and just work towards continuing to get back to some sort of semblance of life that we knew in the past while maintaining risk mitigation and spread of COVID as much as possible.
Bill or
I do
David,
have a
other
question,
thoughts?
on that,
Please.
because we think about the physical issues, obviously, but I still have concern about the emotional and mental issues that youth and adults, and we all know the stress and anxiety is going up the longer
the social isolation.
and the isolation and all that means. We talk about, do an alternative activity. Well, some families do not have access to some of the things I just mentioned. They may not have a bike or a safe place to ride or a kayak or whatever. And as we move forward, yeah, we hope that everything starts to diminish, but we have to help our youth get back to being people again like they're used to. And this is hard when you think of them going back to school, Bill, and being in a building together. It's not just going back and playing sports at that school. It's in the classroom together and what that means. And I have a huge concern. Now, we have a mental health expert on our sports medicine advisory that is tuned into that. We have resources available. KU Health System has lots of resources there, but that's what I'm watching too, and that's what I've asked our athletic trainers to watch, and coaches are aware of that, is what's the effect on that individual from an emotional, mental health status, not just physical.
That becomes part of the equation that a family
Absolutely.
has to consider. If your kids are struggling a little bit, then it's like, you know what, we're going to take more of a risk and let's get them back out there. And that's okay, right?
Yeah.
Those are the decisions we make every day about our families. And our
I've
children.
seen that if we take the COVID out of the equation and it's a knee injury or whatever it is,
Same
or
thing.
back pain, and they're playing football and they don't want to say something because the coach might think they're a wimp. And the anxiety goes up, and we're on the sidelines seeing some of these very anxious athletes that I didn't used to see young in my career. We have a very high level of anxiety right now, and we need to be tuned into that, along with, don't get me wrong, the physical part is very, very important.
Oh, but it's all
all together.
It's health, right?
Our
That's
health
what, that's
is
what
all
health
that.
is.
Exactly.
You bet.
All right, let's rapid fire through some questions if you want. One of them is a physical therapy company. What should I do to restart my business? Is it
All right,
safe?
Dave, what are you telling about physical therapy? You guys.
Well,
work all
we
the time.
reopened at KU Health System, but obviously we have guidelines too, and it's no different than the clinic, the hospital. We're being very careful, screening and wearing masks as we care for patients, and so the private physical therapy groups are well tuned into this too. I have not visited one of them, but I hope that they're doing the same, cleaning their equipment. I've had patients tell me it isn't the same going to a physical therapist anymore. You don't feel like you get as much close hands-on, and a lot of physical therapy is just that. But physical therapists are professionals, and they should be doing the same thing that all of us are doing in our clinics and hospitals.
Well, it's really important. As a weekend warrior myself, I've had a lot of frequency with physical therapists here in the
Right.
health system, and they do a fantastic job.
Absolutely.
But it comes back to the basics of infection control.
Yep.
Wear a mask, wear a mask, wear a mask. Wash your hands.
Wash your hands,
You know,
equipment.
it's all the things we tell everybody. And I know I'm not supposed to pound the table. Sorry, team, because I know that everybody hears my table pounding.
You made your point.
Yeah, I did make my point several times, as it turns out.
Cheerleaders, dance partners, band members, less than 6 feet for 2 to 3 minutes.
man.
Safe? Not safe.
I actually addressed that last week, so I'll hit on it again. There's going to be different cheer formations. You're not going to see the pyramids and things. And the band, I'm not a band director. I love marching bands. They're going to have to figure out that. They're blowing their
Well, it's
horns.
the
They
blowing
can't
the
wear
horns.
a mask.
But I think the secretions are going to get caught a lot. I
Yeah.
need to comment about the horns and the reeds and things like that. I was in a marching band,
Good.
getting run in my mouth. But I think that the tubing for the instruments
Yeah,
and the
I would
reeds are
agree.
going to really filter out
Yeah.
most of the major particles.
I would agree a lot of that. And also, you're probably going to be outside for the most part.
Right.
Yeah, I don't know about bands when you're going to be in for basketball games, but certainly on the football field, you will be outside as well, and I think that'll help. But I agree with you about the secretions.
Yeah, we'd have to. We'll go take that question and go see if we can find something out about instruments and the spread of COVID. But I'm going to bet it's not. But don't let other people touch your mouthpiece. I mean, that's a bad idea.
Right.
Yeah.
At the beginning of the program, you talked about resources, sports standards. Where can we find those?
Well, you could start with KSHSAA. KSHSAA has a website, and you can download the guidelines and implementation of these. It's an excellent, it was reviewed by our Sports Medicine Advisory. It's out there on that website. The Kansas Parks and Recreation has their resource. CDC, when I looked at that, is good, but it's very general. It's
Yeah, it is.
extremely general when it comes to
KDHE does a
return.
good job for
The
general, for
KDHE
things
is-
like that. But Bill, talk a little bit about your website. How do you keep it updated, and where do you look to get more information?
Well, we talk every day as a staff and answer questions, keep our frequently asked questions up to date, but that's more on the competitive side. On the medical side, we rely a significant amount on our local expert, which is Brent Unruh, who is one of our staff members, who's a certified athletic trainer, and also our liaison to the Sports Medicine Advisory Committee. And our SMAC committee does a fabulous job. They're very responsive. Dr. Salazar over at KU in Lawrence is a great resource. And we have had a really good response. Anytime we've had a specific question, they help us provide that guidance and help us develop not just the general guidelines, but the very specific responses as appropriate for questions that come in.
So the school districts, they're all developing, and I've reviewed 3 school district guidelines, and again, we try with our athletic trainers going out there, making sure they're medically sound. The school districts are working really hard on this too, so you should at least
I think a lot
check
of
that
that,
out.
and it feels like it's coming together around common themes. And we're working with KU on their reopening and their athletic thing. We're going to be working with a number of other Kansas Board of Regent universities in order to try and make sure that we're consistent and the infection control practices are best in class. So.
Will the summer heat and UV rays make playing sports outside safer? Going to kill that virus?
Yeah, kill it, Dane. Let's go, man.
Yeah.
Tell us some
Again,
good news.
I don't think that the heat itself is going to have an impact. We understand that there are seasonal variabilities to other respiratory viruses like influenza and the common coronavirus that causes the common cold. I wouldn't say the heat necessarily itself. Even when we were looking at best practices for reusing masks, the heat that it would take to kill is 160 degrees
It's
for.
hot, yeah.
So, but now the UV radiation is something different. The UV radiation will certainly probably have a little bit of effect, especially if it's on the surfaces outdoors. We know that UV radiation is very efficient at killing microorganisms. So
But just
it'll
remember, we have a
little
lot
bit effect.
of corona down in Florida and
Yeah.
in Phoenix, Arizona,
Absolutely.
and in Southern California and San Diego and in LA. So just be thoughtful, because those are areas with more heat and more sun, and yet there still is corona. We know that it's also a problem in equatorial countries, so the countries along the equator.
And even here, when we inactivate our test samples for coronavirus in our lab, we are doing it at 45 minutes at like 170 degrees anyways. So that's just to kind of give you a little bit of information about the temperature itself.
And I was going to say that should not negate the importance of cleaning equipment and things. I was asked the question, well, if I leave my bat out in the sun or throw my mitt on the side, will everything that'd
Clean
be
it.
fine? No, you got to
Clean
keep
it.
doing the cleaning. Absolutely.
Okay, fans in the stands, what kind of advice? In particular, one person is asking, I have an N95 mask, can I reuse it? Should I put a charcoal filter in it?
Oh boy. N95 masks in the stands, Dana. I think that, I'm not sure about an N95 in general public use
Yeah.
in the stands.
I
I
don't-
guess if you're really packed in, maybe you could consider it, and if you have a chronic disease. But otherwise, masks are to prevent your secretions from going out,
Right.
not to have them come into you. Now, you can wear an N95, but if you're not wearing it right, or you haven't had it fit tested, it's
Correct.
really just a regular surgical mask then. It's not any better.
Yep, absolutely. I think the main thing for that is you're going to want to try to be physically distanced as much as possible. 6, 8, 10 feet is much better than even the 3 feet. If everybody's wearing a cloth mask or a surgical mask, that's great, because we are concerned about people who are pre-symptomatic or asymptomatic, possibly spreading the disease to other people. And we know that when both parties have masks on and the distance is further, we know that there is a decreased spread of the disease. So.
And that false sense of security, Dana, that you just mentioned. You're in the stand, I got a mask on.
right.
And then you watch people. I watch it all the time, handling it. It's under the nose, under
Yeah,
the
they
chin. They're
touch
getting
it. Yeah,
hot.
that
And
doesn't
they're
happen.
sweating in the stands, too. And
I think the key is that distance, and being outside does make all the difference from being inside. I think it's going to be a lot harder, I hate to say this, to reopen the basketball arena at KU than it is the football stadium. And I'm not making some comment about football and basketball at KU. I'm just talking about inside, outside, and how closely packed people are. And so that's going to be a challenge.
And
for
I
us.
think to David's point, exactly, even when we get to the summer now and people are wearing masks, even just sitting on the sidelines and watching, you're probably going to be sweating. It's probably going to be extremely uncomfortable. The heat's going to be retained. So I think the best practices to start with there is obviously adequate hand hygiene and physical distancing as much as possible.
Right.
And think
if
about
you're
it.
going to go around people and you're even closer, then you put the mask on.
Yeah, think about it.
Far
You need to
away.
hydrate. So you're grabbing your bottle, moving your mask to
Yeah,
hydrate. There's
it's
going to be a
kinda-
lot of
it's a
hand
little-
touching.
There's
so.
some things about masks that aren't really all that well outlined yet. So.
I want to add to my bubble so badly. In particular, one person writes, my family bubble, my social bubble. What if I go visit two people who've already had COVID and they're recovered? Is that okay?
Okay, Dana, bubble
you go.
size. Here we go.
I think bubble size needs to be taken very slowly and a cautious approach. I think with the COVID recovered, are we sure that they are COVID recovered? I think the farther you get out from the original diagnosis date of anyone, as we have seen a little bit of information, but there's still a paucity of references and data. There was that Singapore study that showed you aren't really infectious after 11 days. That was a very small study. One study does not make guidelines or practice. But I think doing those types of things, the further you get out from the original diagnosis, probably the safer you are. We understand that in some of the South Korea experience, that if people are coming back with symptoms, they aren't really found to have new infection or active virus, but rather more of the immune consequences of that. I think you can still need to take the precautions that we're talking about, hand hygiene. Certainly if you're indoors, it may be reasonable to wear a mask, things of that nature. You may be a little bit safer if you know that they've had it and recovered, and especially depending how long ago it was. Certainly 3 to 4 to 5 weeks, 6 weeks, you're probably a little bit safer. I think overall, there's probably no good answer. We still need to continue to take some precautions.
And Dana, that slow increase in practices, the bubble does get bigger as we get them more and more on the field, and yet the asymptomatic and pre-symptomatic person out on the field, they don't know. They're spreading potentially.
It all comes down to what's your risk threshold. Again, we keep saying this. How much risk do you want to entertain? That's your answer, and it's a personal decision, I think. One more question.
One athlete, one band member, one cheerleader, one dancer, they test positive. Who has to quarantine?
Oh, great one. Okay. Take it, Dana.
I get, depending on it,
if you're in a cheerleading group and one person, or a band, one person, or a basketball team, one person, if one of them, how many of the other folks within that band or within that group have to go quarantine?
Yeah, I think this is why we will hopefully rely on our excellent improving public health county health departments to help do the contact tracing for that. That is all going to be determined on when was the person symptomatic. I think now for contact tracing they are using 2 days prior to symptoms. So I think and then you have to determine, well, how close were you? If you were just at practice and mostly apart from each other, that's probably not the same as being in close proximity for an hour at a dance or a cheer practice, something like that. So I think we're going to have to start to rely on further guidance, especially from our public health departments, about that and the contact tracing and determining the level of exposure.
Yeah, and that's something I'd say it's to reopen sports, in my opinion, is not too hard. It's maintaining sports, and that contact tracing obviously very important. But that's the message I want to deliver to the athletes: is you want to keep playing sports. These things that we're talking about preventatively and to mitigate risk are important. You don't care, you don't play. It's kind of the answer I have.
Well, I think if you've been in close contact with somebody who's positive, you probably have to be quarantined. That's what we would tell anybody else.
Right.
And that's contact tracing. If you've had a real contact, you're going to have to get quarantined. And I think that's just the answer. So, well, listen, as we wrap up today, I want to say special thank you. I know that Bill probably has 1,000 things to do, but any parting comments you'd like to leave us with, or last thoughts?
Well, thank you for the opportunity to be part of the program, and thank you for your leadership. We appreciate the support because our kids are worth it, and we are very fortunate to have the guidance that you provide through our local health communities, both and as well as at KU. So thanks for that opportunity. We look forward to seeing kids back in competition when it's safe and appropriate to do so.
Dave?
I just want to thank the media and the parents and out there asking questions and having care about this, because we care. We really care about what you're thinking and feeling, and we don't have all the answers. I said it before, there's not an absolute yes, no, right, wrong. This is a new world for us, and yet we keep the questions coming so we can be challenged by those. And I appreciate the experts in this whole panel and the opportunity to do this too.
Nope, I think as we move further in now, we're really getting into these summer days. Even though it's still spring, it's going to be hot. People are going to be moving outside. Pools, I think, are starting to reopen. Obviously, athletics is starting. We need to just hammer home and continue to endorse our messages of physical distancing, not going out when you're ill, wear masks if you can. Try not to be in enclosed spaces, and absolutely continue to do adequate hand hygiene.
Well, we just want life to be normal. Yeah, but it's not. Not yet. It's coming. It's coming. It'll be back. But whether you're in the streets protesting injustice, whether you're out on the practice field with your child who desperately wants to get back out and play, you want to get back to church, you want to get out and go camping, whatever you want to do, just remember that the pillars of infection control don't change. They've kept us safe. We've done a great job here in Kansas City. So just remember, until we gather again, that there's still no place like home. We'll see you tomorrow.